Have you ever woken up with a yellowish tongue, slightly yellow eyes, or itchy skin for no apparent reason? You might have brushed it off and thought, it's just fatigue, an allergy, or the heat. But I need to tell you something that changes everything. The liver is the quietest organ in the human body. It can handle decades of overload without complaining once. And when it finally starts sending signals, most people have already been living with clues scattered all over their bodies for months. It's just that no one connected the dots. Today I'm going to show you 7 signs your liver sends before the problem becomes serious, what to look into, and when to stop ignoring it. Before we get to the 7 signs, here's a quick overview to help you understand why these signs appear where they do. The liver has over 500 documented functions. The main ones: filtering toxins from the blood, producing bile to digest fat, manufacturing essential proteins like albumin and clotting factors, regulating sugar metabolism, and processing medications and alcohol. When it fails on these fronts. The signs come from there. 2 important things before we continue. The liver has no pain-sensing nerve endings, so it doesn't hurt early on, and it doesn't show up on a basic routine exam unless the doctor specifically orders it. Keep that in mind. Sign 1. Fatigue that doesn't improve with rest. You sleep 8 hours and wake up exhausted. The day starts off heavy. Your energy is gone. You blame work, age, stress. But when the liver is overloaded, it can't filter metabolic toxins from the blood efficiently. These toxins circulate and reach the brain, causing that diffuse fatigue, that mental fog that doctors call subclinical encephalopathy. It's not depression, it's not iron deficiency. It's the liver screaming silently through the nervous system. On its own, this sign doesn't mean much. But together with the next ones, it says a lot. Sign 2. Discomfort on the right side of the abdomen. The liver is located in the upper right quadrant of the abdomen. When it becomes inflamed or swells, the capsule surrounding it stretches. This capsule has nerve endings. So what you feel isn't sharp pain, it's a dull pressure, a heaviness, a sensation of something in there. Many people mistake it for back pain, rib pain, or gas. But if this discomfort appears on the right side, just below the ribs, and worsens after fatty or alcoholic meals, the liver needs to be investigated. I see this report frequently in patients who have spent years taking anti-inflammatory drugs without medical supervision. The liver pays the price in silence. Sign 3. Yellow skin and eyes. This has a technical name, jaundice, and it is one of the most important signals the liver can send. Bilirubin is a product of the breakdown of red blood cells. A healthy liver processes and eliminates this bilirubin through bile. When the liver fails, bilirubin accumulates in the blood and begins to deposit in the tissues, staining the skin and eyes yellow. Jaundice can appear mildly, as a subtle yellowish tint in the eyes that you notice only in natural light. Or it can be more obvious, with visibly yellow skin. If it's accompanied by urine as dark as mate tea and very pale or whitish stools, it's a major red flag. This indicates that bile isn't reaching the intestines, and the cause needs to be identified urgently. Don't wait a week to pass. Seek medical care. Sign 4. Itchy skin with no apparent cause. This is one of the most underestimated signs of all, and one of the most specific indicators of liver and biliary problems. When bile doesn't flow properly, bile salts accumulate in the bloodstream and deposit on the skin. They irritate the superficial nerve endings and cause intense itching, especially on the arms, legs, and palms of the hands, which worsens at night. Dermatologists treat this itching with antihistamines for months without success, because the cause isn't in the skin, it's in the liver. If you have persistent itching that no medication resolves, ask your doctor to include the liver in the investigation. It's a simple question that changes the diagnosis. If this video is helping you connect dots you've never connected before, give it a like now. And do me a favor, think of someone in your family who has fatigue without explanation, discomfort on the right side, or unexplained itching. Send this video to that person. It might be the information they've been missing. Now, the 3 most alarming signs, and the ones that save the most lives for those who pay attention. Sign 5. A swollen belly without weight gain. This sign has a name, ascites. It's the accumulation of fluid inside the abdominal cavity, and it occurs when the liver loses its ability to produce enough albumin. Albumin is the protein responsible for keeping fluid inside the blood vessels. When its levels drop, fluid leaks out of the vessels and accumulates in the abdomen. Ascites causes a rounded belly that looks distended even in people who have lost weight elsewhere on their body. When you tap the sides of the belly lightly, it feels like a wave, like fluid moving. If you or someone close to you has this combination, a belly that grows while the rest of the body loses weight, this is not bloating from gas. This requires immediate investigation. Sign 6. Changes in sleep and behavior. This is the sign that families notice before the patient does. When the liver cannot properly process ammonia, a byproduct of protein metabolism, this ammonia accumulates in the blood and directly interferes with brain function. The result can be reversal of the sleep-wake cycle, irritability for no reason, frequent forgetfulness, slow thinking. This is called hepatic encephalopathy, and it can be subtle at first. The patient seems strange, different. The family notices but attributes it to stress, age, or emotional problems. If these signs appear in someone with other items on this list, it warrants a hepatological evaluation, without delay. Sign 7. Easy bruising and slow bleeding. The liver produces most of the blood's clotting factors. When the liver is compromised, production of these factors drops. The blood loses its ability to clot normally. The practical result: you bump into something lightly and a huge bruise appears. You get a superficial cut and the bleeding takes a long time to stop. You get a blood test and the spot stays purple for days. Many people attribute this to thin skin or age. But a tendency to bruise easily, especially in younger people or those without a history of clotting problems, is a sign that warrants a liver workup. If it comes along with any other sign on this list, don't ignore it. What overloads the liver in daily life? 4 factors I see constantly in the clinic. Regular alcohol consumption. It doesn't have to be in extreme quantities. Frequent consumption, even moderate over the years, leads to progressive inflammation in the liver tissue. Chronic use of medications without medical supervision, anti-inflammatories, painkillers, repeated antibiotics, all pass through the liver. Without monitoring, the damage is silent and cumulative. Metabolic syndrome, abdominal obesity, high triglycerides, insulin resistance. This combination is the main cause of non-alcoholic fatty liver disease, the so-called fatty liver. Ultra-processed foods and excess industrial fructose. The liver processes fructose differently from other sugars. Excess fructose is converted directly into liver fat. The same old factors for an organ that takes its time to react and exacts a heavy toll. What tests to order? If you identified with 2 or more signs on this list, here's where to start. ALT and AST, transaminases. Enzymes that leak into the blood when liver cells are being damaged. Elevated levels above the threshold indicate active inflammation. GGT and alkaline phosphatase, markers of damage to the bile ducts. They rise when bile flow is compromised. Total bilirubin and fractions. Assess whether the liver is properly processing and eliminating bilirubin. Full abdominal ultrasound. Inexpensive, radiation-free, and can already identify fatty liver, changes in size and texture, and any nodules. If any of these 4 tests show abnormalities, the next step is liver elastography or an abdominal MRI, depending on the findings. But that's a conversation for a gastroenterologist or hepatologist. Write here in the comments, have you had any liver tests recently? Were your results normal? I read the comments and I'll answer. And if you have a specific question, it might become the next video. The liver doesn't hurt right away, but it gives you warning signs. It warns you through fatigue that sleep can't fix, through a subtle discomfort on the right side, in the yellowing of the eyes, in the itch that no medicine can treat, in the belly that swells for no reason, in the behavioral changes that your family notices before you do, in the bruises that appear easily. An isolated sporadic symptom could mean many things. The pattern that persists, the set of symptoms that repeats, that's what matters. And remember, the liver has an enormous capacity for regeneration, but only if the cause is identified and treated in time. Take this list to your doctor and ask directly, "Doctor, is my liver being evaluated in my tests?" That's a question worth asking. If this video made you think of someone, a parent, spouse, or close friend, send it to them now. This kind of information, when received early, changes the story. Leave a like if the content was helpful, subscribe to the channel, and turn on notifications. And watch the video now about the 7 silent signs of the pancreas, because the liver and pancreas work together in the same digestive system. Signs from one often serve as a warning sign for the other. See you in the next one.